Right. Good morning, good afternoon, good evening to everyone who is listening from wherever you may be. This is the presentation that I made on the occasion of uh, World Mental Health Day, 10th of October, 2021, which is just about 2 weeks ago. Mental health in an unequal world. That is the theme of this year's World Mental Health Day. World Mental Health Day is celebrated every 10th October, uh, and it is acknowledged by the World Health Organization as one of the important aspects of the campaign to make mental health awareness more widespread. It was actually started as a project of the World Federation for Mental Health. And World Federation of Mental Health is a global NGO that does a lot of valuable work in spreading awareness about mental health and mental illness. And they came up with the idea of observing 10th October, 10/10 of every year. And each year they have a different theme for this. So this year's theme is mental health in an unequal world. I am Professor Deva. I'm a senior professor of psychiatry at University of Rahman in Malaysia. And that's my email address. In policy decision-making towards mental health, illness, and mentally ill, there is very wide discrepancy. It is not just mental illness that we are concerned about. It's also the attitude and the services that are provided for them in many, many low and medium income countries. Stress-related illnesses, which are far more common than the services provided for the mentally ill through hospitals and psychiatric wards, rank far below that of physical illnesses, especially in LAMICs, in low and medium income countries. Mental health in an unequal world is really exemplified by the fact that vast majority of people with mental illnesses that are related to stress are neither recognized and treated in the primary care setting, where they constitute about 30% of all patients in any primary health care clinic, but also not seen in the psychiatric clinics because patients are not severely disturbed. Through practice and wrong teaching and wrong decision making, most of the psychiatric wards, psychiatric hospitals are only for the people who are severely ill and disturbed. But they form around 7% of all mental illnesses. About 80% are in the primary care setting, where they are not so disturbed, but they're equally distressed. They may not be visible to the others, but they are upset, they can't sleep well, they can't concentrate, they feel low in their spirits because of problems at home, problems at work, problems with the family, problems with money, problems with children. That has not led them to a psychotic illness, but it's distressing them. It's upsetting them. So we have inequality. The psychotic patients receive a lot of services, a lot of money allocated to them for a relatively small number of people because they're disturbed. Sure, because they're disturbed, they need more attention, that we understand. But the majority of people with distress who are stressed due to any cause, problems at home, like COVID, for example, now, people are dying, people are dead, people are unemployed, and how it affects the family, how it affects society, is not given as much importance. And before COVID times, even less. There are stress-related problems in every primary care setting, where 30% and sometimes more, actually have significant psychiatric distress, but they are not psychotic. So it's an unequal world. The majority of people who require psychiatric help do not get it because the primary care people don't recognize it. And the psychotic ward full of psychotic patients, do not see them because they're not psychotic. So who sees them? Well, very poorly done by some doctors and some people. By the way, all these flowers that you'll see in the subsequent slides also are from the Suva flower market in Fiji, part of the Pacific Islands Mental Health Network, or PIMNET. In medical and healthcare, mental is more often an afterthought in terms of priorities. I know of many large modern hospitals, general hospitals, built at a cost of 250 to 300 million US dollars, with about 500 to 600, 700 beds, that do not have a single psychiatric bed, nor a psychiatric clinic. They're built without a psychiatric clinic. Only after that, when the hospitals were built, were the psychiatrists posted there, and they had to create a clinic using other people's clinics because none was allocated for psychiatry. Starved of resources, deprived of basic facilities, from the highest levels to remotest regions, mental hospitals and locked wards still hold sway in the lower and middle income countries. So that's mental health in an unequal world. Billions are spent in low and medium income countries on the incarcerating the severely ill, while the billions of stressed, anxious, and depressed are left at risk of non-communicable diseases and remain poorly managed in primary care settings. Mental health in an unequal world. Institutionalized and sanctioned inequalities, officially sanctioned by the ministries of health and the people in power. Inequality in the name of psychiatry is carried out every day. Care facilities for mentally ill in LAMICs are very far cry from those in general hospitals. The moment you enter the hospital grounds, you see this: barbed wire, high fences, locked doors, locked windows. You go to a general hospital, it's like this. And even in a poor country with no curtains, it's relatively humane and decent, not like this. Making health staff, professionals, and even the public to think that mental illnesses are all about madness, whereas only less than 10% suffer from psychosis. So that even healthcare professionals do not want to get their relatives or themselves admitted to a psychiatric ward when they are simply depressed, anxious, or stressed, or may have taken an overdose. In some countries, even poorer countries, there is no psychiatric facility. There are a lot of medical facilities. Almost in every island, there is some kind of medical clinic, medical ward, a few beds here and there, but none for psychiatry. Doctors and nurses all about psychiatric patients as though they are a plague. Mental health in an unequal world. Mental illness is like any other illness, say our leaders. I've heard this so many times. Mental illness like any other illness. But this desperate family copied a cell where their son was treated in a mental hospital and built one at home after they failed to find proper treatment, costing cents a day. Medicines were not available because They were only available in the big towns, and they didn't know how to get there. They had to leave their job one day to go and buy the medicines, because the pharmacy, the local pharmacy, would not sell any psychotropic drugs. So they built a cell for him at home. Poor services, poor availability of medicines, and lack of trained staff cannot be made good by slogans, theory, and practice. The roots of the unequal world that mental health exists in is one that is heavy in theory and very rigid in practice. This is obvious even in the 21st century, as minds and attitudes have hardly changed. Thus, school students in Islamic are taken for an outing to a mental hospital, and healthcare staff do ward rounds through the grilled windows. Learning mental health this way guarantees perpetuation of ignorance, fear, and sequestration of psychiatry in the practice of medicine. The abuse it has been in for centuries does not matter what the latest in medicine has to offer. Many people are under the belief that the newer medicines will cure everything. This is a myth. Newer medicines control symptoms better. They cannot cure it. Mental illness is both medical and a social and a psychological illness. So that the gap between theory of treatments and the practice of treatments and the outcomes of treatments shows that mental health is in an unequal world. Even psychiatrists in the 21st century fear the mentally ill and contribute to retention of the mental hospital. Efforts have been made in every continent in the world to try to get rid of mental hospitals, but they continue. Not only continue, in some countries, new mental hospitals are being built. Large mental hospitals are being built as a matter of policy from top down. So even psychiatrists in the 21st century fear the mentally ill and contribute to the retention of mental hospitals, and refuse to champion change, the revised priorities, in teaching for changes in well-known universities, and overemphasize the less than 10% of severe mental disease at the expense of a blissfully ignoring WHO's 2001 mental health report 21 years ago, or 20 years ago. So it's one thing to come out with pronouncements that we need to do this, we need to do that, but nobody's practicing it. Why are people not teaching psychiatry in primary care? Why is that every primary care clinic does not cater for the mentally ill? The moment the person has got mental problems, even stress, they say go and see a psychiatrist. But the patient often says, I'm not mad, I don't want to go and see a psychiatrist. So this is the unequal world of mental health. Any wonder why multi-million-dollar campaigns by governments, local, international, and global bodies to eradicate stigma have fallen flat year after year? Professionals in mental health have in no small way tolerated the inequalities in care and publicity. Do what I say, do not do what I do. Mental health in an unequal world. Practice versus theory, stigma versus sloganeering. Slogans cannot cure stigma. In reality, this is a flower stall in a large garden town in Sungai Buloh, Malaysia, and was until recently the second largest leprosy hospital in the world. Medicines, political will, and good funding all but wiped out leprosy, but left many of its thousands of inmates deformed, but leprosy free. They had lost their fingers, lost their nose. There was a big gap in the center of their face, lost their eyes. They, on recovery from the illness, but not the deformity. Some of them underwent plastic surgery with success, as best as could be done. They started this garden town to supply all sorts of flowers, plants, and decorative trees, and turfing to at least 3 countries, and even employ workers from overseas, because they were now reaching the level of millionaires. Many TB hospitals, leprosy asylums, and mental hospitals in Lamix were stigmatized and cited out of reach and out of mind of the populations in one area. All the dregs of society that nobody wanted and was heavily stigmatized was put in one place. The far more severe stigma of leprosy and deformity no longer stigmatized, and TB, and treated in general wards, general clinics with no discrimination, but not mental illness. Why not? In the 21st century, man is ready to go to Mars, had landed on the moon, is in space stations. But we cannot get rid of that stigma of mental illness, which is all around us. Mental illness suffers from an unequal world. So there's a need to shift the paradigm, shift the comfort zone we are in, which is not helping anyone, progressing the stigma, damaging people's lives. The paradigm shift, or thinking out of the box. So we started a stress management ward in Fiji. There are 3 now there. One in stress management clinic in Fiji, stress management clinic in Malaysia, stress management clinic in Cook Island. From these small beginnings, like this stress management clinic made out of a container at a cost of less than $2,000 US. So what we did was we created stress management clinics, stress management wards, so that the stigma that we have been under for such a long time will slowly start diminishing. Luckily, with COVID, many of the students have never been to a locked psychiatric ward for the last 2 years. So that's an advantage of COVID. COVID had done many bad things, many bad things, and a few small good things. And we started teaching in primary care settings, not in the psychiatric ward. So that is how we start changing the concept of destigmatization. So to celebrate once again this year's World Mental Health Day, and to change the unequal world in which psychiatry is, and to reduce the stigma, let me first of all thank you for listening to this. And I hope that you will gain something from this and try to put some of it into practice. Thank you very much.